Dr. James Davis.
Thank you, Chair. Thank you, Secretary of State. I'd like to return, if I may, to the success of certain countries in South and Southeast Asia, so South Korea, Singapore, Taiwan, and so forth. We've already touched on their pre-existing testing capacity. Were you given advice not to follow their strategies in other respects?
No, I don't think we were advised not to follow their strategies, but I can't remember being formally advised to follow their strategies, but we did have discussions. With them.
Mm-hmm. And in retrospect, you would agree that there should have been more focus on what was going on in that part of the world and their success?
Well, there was a huge amount of focus on what was going on in China, although one of the things that hindered our early response was a lack of transparency from China, and that must be put right in terms of future preparedness for future pandemics. It is absolutely vital for the world that China is more transparent about its health information as soon as it understands that there are problems in future. With respect to the rest of Southeast Asia, I think that we would benefit a lot from ensuring that our future pandemic preparedness learns from the other from different strategies that were pursued right around the world. The strategies different countries pursued, in my view, followed essentially two things. One, their recent history, and the countries that obviously had, it's standard now to say that the countries that had experienced MERS and SARS were better prepared, partly because their body politic had had a shock a decade earlier. And here, that shock in around 2009 was not heeded as much as it should have been. The second is in terms of their capabilities and, to an extent, their geography and history. So it is harder in a democracy to take some of the steps that some of the authoritarian countries took. Geography matters. So Britain is an island, and we have the benefits of being an island in terms of borders, but we are a highly interconnected island which has a tunnel, and a huge amount of our freight comes accompanied. So other islands like Australia, New Zealand, Taiwan were able to be more absolute at the border, whereas completely shutting the border here is not something that we are structured to do, because I think a very serious chunk of our daily imports comes accompanied, and then of course this history is also about the capacities you have at home, and we just didn't have that the testing capacity in particular, and the contact tracing capacity that others had.
We didn't have the capacity, but was it discussed that British people wouldn't accept East Asian testing and tracing methods?
Well, there was a debate about how much people would accept it, but I was always of the view that people would go for it, and my view on the use of data was that because the mission and the motive was so important, people would be willing to allow their data to be used, because and give consent to that, because the justification was so clear. The story that I told at the time is, over 95% of people are willing to give their iris scan to the Home Office in order to have a queue that's maybe 5 minutes faster at the Heathrow when they go on holiday. And if you're willing to give your biometric data to the Home Office, you're likely to be willing to allow your data to be used to save lives and try to stop a pandemic. So my view on the public's approach to consent for their use of data for these purposes is that my experience is that they are very enthusiastic so long as there is a proper mission, and there was a clear mission here. So I was up for action in this space. I personally didn't think that would be a problem so long as we articulated it properly, we got all the privacy rules, etc. right.
Mm-hmm. Now, Dominic Cummings alleged that there was a lack of urgency in our approach to the pandemic in February and March because we believed ourselves to be lower down in the pandemic curve. he also said that the implementation of measures was delayed because there was a lack of planning and preparations in place. And how would you respond to those 2 points?
Well, the first is true and the second is false. So it's absolutely true that we thought, and the advice we had was that we were earlier in the pandemic curve than our European neighbours, and we were, as it happens, we were seeded. The virus, we now know from genomic testing and the huge genomic testing capability we now have, that there were thousands of individual incursions right across the UK. So we didn't have an outbreak in individual areas. We had an outbreak essentially everywhere at once. And that was one of the reasons that we had a tougher first wave, along with frankly the fact that the population isn't as healthy, and we know that obesity is a significant risk factor. So that was true. On the second point, the idea that we didn't have a plan, the evidence I can best point you to is the fact that we had at that point published a plan.
Okay, fair enough. Finally, from me, in terms of face coverings, now SAGE discussed in late April the fact that there was some evidence, albeit weak, for the use of face coverings. Then I think on the 11th of May, they had issued advice for their use in enclosed spaces. Then the UK government mandated their use on the 15th of June in public transport settings, 24th of July in shops, 24th of September elsewhere. For the record, in Wales here, that was 6 weeks later, I think, for each change. But why was there a delay, first of all, in implementing what SAGE was advising, and also why were we as a country as a whole perhaps behind other countries in the world?
Well, there was a rigorous international debate about the use of face masks, and there were very significant divisions in the science on this. And I think that it is one of the clear lessons from the pandemic. It comes down to disagreements about the most likely route of personal transmission of the virus from one person to another, and there is now a common understanding, much more about aerosol transmission from one person, and how face masks are therefore more important than was the initial advice. There is also a practical consideration that we didn't want people to take face masks away from where they were absolutely vital within health and social care settings. And so when we did introduce rules around public's use of face masks, we introduced them saying that you should wear a face covering, as many people in this room are, because that way it didn't take away from the provision of PPE. Now that isn't a problem. We've got huge stockpiles of it, but it was a problem at the time.
Thank you, Chair.